Terrific. Well, thank you all, the panelists, for taking the time out today. There's been a lot of news breaking in the last little while about public policy and about supports for services that we all count on. And one of the most prominent has certainly been around childcare. So I'm delighted to have Carolyn Ferns from the Ontario Coalition for Better Childcare to be here to talk to us about the issue as a whole, but also the breaking news on that front. Carolyn.
Thanks so much, Sean. And thank you for inviting me today. And it's March 31st today, and just over a week ago, Sean and I were talking. He said, "Do you think by the time we have our event that Ontario will be signed on?" And at that time, I said, "It's a 50-50. I don't know. I really don't know." But amazingly and thankfully, on Monday we saw the Ontario government finally has signed on to the Canada-wide childcare plan. The last province or territory to do so, but that means that now we have every jurisdiction signed on to the federal childcare plan, which is a major and historic announcement. And of course, if we hadn't signed on, we were going to lose $1 billion in funding, but that means that funding is now flowing. And the good news, the big news and good news out of the announcement on Monday is that this is going to make a measurable difference for hundreds of thousands of families almost immediately this year, who will see their childcare fees cut in half in this year alone, and then move down to $10 a day over the next several years. Now, as Laurie was saying at the opening, of course, the pandemic has been really difficult for licensed childcare programs and for families. For the sector, it has meant instability. We saw some programs close. But over this past year, we've been able to go from a place of a real uncertainty to somewhere where I say I can see a really good and positive future for early learning and childcare in Canada, and certainly for families. But that said, and all of the good news and positive things that are coming out of the announcement, of course, there's also the things that that we're not satisfied with, and the things that we still don't know, right? And the biggest one, and I know the focus of our conversation is really on how can we make sure that we have sustainable quality services. There's a lot that we still need to push on. Both at the provincial and at the federal level. And the biggest one is around the childcare workforce, because as positive as Monday's announcement was for families who are going to see this fee reduction, the issue of the childcare workforce was really not given nearly enough attention, nearly enough funding, and no solid workforce strategy moving forward. Now, why is that so essential? I mean, any parent will tell you that it's the early childhood educators that are the key to quality childcare. And I've been saying, I think now on almost every radio show all week, that without early childhood educators, it's just four walls, it's not childcare. And for ECEs, the agreement, all it does is set a wage floor of $18 an hour, which would only impact about a quarter of registered early childhood educators right now. And it's sort of a shamefully low wage floor, and we were pushing for $25 an hour. And it's not enough to solve the workforce crisis that we have in childcare, because right now we know that childcare programs are having to close rooms, they're having to limit the number of families they can serve because of the shortage of early childhood educators. People who have gone to school, have done early childhood education, in colleges and universities, go to work in licensed childcare and don't stay. Right now, the average for an ECE to stay in the field is just 3 years. And if we're going to expand the system, and Monday's plan announced 86,000 new spaces are going to be created. If we're hoping to staff even the programs we have now, let alone 86,000 new spaces, we're going to need to solve the retention crisis in childcare and go from a place where people stay 3 years to a place where people make a career working in early learning and childcare. And we're going to have to recruit thousands of more folks to come in and work in childcare too. So I think the key issue that we still have to address is the workforce. And we're going to have to do that provincially. You know, we've seen what is in the agreement, but of course, the province could be doing so much more and should be doing so much more. And so that's something we're going to continue to work on. And then of course, the expansion is another area, right? We've heard that there's 86,000 spaces planned now, but of course, to serve every family that needs it, we're going to have to create many more than that. Opportunities that I see on that, I think we've heard a rumor, and then it wasn't addressed on Monday's announcement, but we might see it in the federal budget, which would be a new infrastructure fund for childcare. And that's something that I think that municipalities and nonprofit childcare programs are going to have to look at really closely, and is a major opportunity. Thanks, everybody.
Thanks so much, Carolyn. And certainly an awful lot happening there, and still it sounds like an awful lot more to do. As huge as the news is about childcare, certainly one of the things that has been pressing on the minds of people who were thinking about public services and available services that we rely on throughout the pandemic, long-term care has loomed pretty large. Tana Kane is here from the Ontario Nurses Association to talk a little bit about how the policy environment around long-term care is affected and how it needs to change.
Thanks very much, Sean. Hi, everyone. My name is Itana. I'm the Manager of Government Relations at the Ontario Nurses Association. And also with me is Jean Keel, who's a retired registered nurse and a former bargaining unit president, who's the real expert. So I'm going to talk briefly, and Jean will be after me. But for those of you who are not familiar, the Ontario Nurses Association is the union that represents over 68,000 registered nurses and healthcare professionals working across all health sectors. And this includes nurses and healthcare professionals in approximately 314 long-term care facilities across the province. Over the last 2 years, we've all borne witness to a terrible humanitarian crisis in long-term care. 4,291 residents in long-term care died of COVID-19, and they passed away without their loved ones having access, often in overcrowded conditions, often seeing their caregivers staff with inappropriate PPE because the N95s were locked up, or the province didn't ensure supply. We know that 13 healthcare workers in long-term care passed away. They went to work to do their job, to take care of residents, and they were underprotected. So we owe it to their memory to ensure that systemic change happens finally in this sector, and if not now, when? So I want to start with staffing, and Dr. Pat Armstrong from York University said it best, which is that the conditions of work are the conditions of care. And pre-pandemic in long-term care, the residents were receiving on average only 2 hours and 45 minutes a day of direct care from nurses and PSWs. And we think that's too low, and we are calling for a minimum of 4 hours of direct care for every long-term care home. And particularly, we need to have more registered staff, especially registered nurses, because the residents in long-term care have more complex care needs, and they need to have the skills, the ability, experience of RNs to provide the care. We need to repeal Bill 124. This is the provincial government's legislation that cuts the wages of nurses and healthcare professionals in nonprofit homes, but also public sector workers more broadly who are majority women. We need to have more full-time jobs and wage parity with the hospital sector. You might not be aware, but a registered nurse that's working in long-term care, especially in a for-profit long-term care home, will earn significantly less than a registered nurse working in a public hospital. And so just like childcare and what Carolyn was talking about, it leads to a retention crisis. And there's a significant RN shortage already in Ontario. So we need to retain staff and recruit staff in long-term care, and that of course means quality care for residents. And more than that, we really have to value care work and value the work that nurses and healthcare professionals do every day. It's a women-dominated profession, and particularly in long-term care, there are higher numbers of racialized women and immigrant women, and we have to value their work. And then finally, I know I only have 2 minutes, We need to get profit out of care. And for-profit long-term care operators, we know that they tend to pay their staff less. They hire fewer full-time staff. They provide fewer hours of care. You know, we know that the death rates during COVID-19 were significantly higher in the for-profit homes. And what's at stake is that there are licenses in Ontario covering around 30,000 long-term care beds that are set to end in 2025. So the provincial government currently is in the process of allocating new beds. And we're talking about 30-year licenses. We're talking about the next generation of long-term care homes. So it's on us to make sure that as many of these beds as possible are being allocated to public, not-for-profit homes, right? This is our opportunity to push forward change. So I will leave it there. Thank you very much.
Thank you, Etana. And you know, as Carolyn said, it's the folks who are there on the front lines who are doing the work that make childcare work, and that couldn't be truer anywhere than in long-term care. And I'm delighted to have Jean Keel, who has spent 28 years caring for people in long-term care, to talk about the thing that's most important about public policy, which is how it affects real people in the long-term care sector. Jean.
Okay, I want to talk about the real cost of for-profit private care to residents and their families. This is a boots on the ground perspective. The for-profit policy has resulted in understaffing and short staffing. This affects every aspect of care, every aspect of that resident's life. Residents get minimum care, leading to issues with hygiene, skin care, nutrition, activation. Remember, staffing is already at a minimum. There are no extra hands. Toileting and hygiene is part of their dignity. Can you imagine someone else controlling when you go to the toilet, waiting, having a soil brief and then sitting in it? How about being bathed twice weekly? If they are short-staffed, that bath may not happen as promptly. You may have to wait an extra day. Mealtime is very important to residents. It's a highlight of their day. Nutrition is so important to their well-being. Residents may not get the hot food they like, and then they do not eat. They get frustrated with waiting and may leave the dining room or just choose not to eat. Someone with dementia needs time and patience. That's in short supply. If a resident doesn't eat, it can affect medication uptake, skin integrity, their sense of well-being. They can't heal without nutrition. How about not enough hands to keep residents engaged and connected? They have given up almost everything that is familiar and valuable. What gives them quality of life? Does someone have time to find out what matters? What gives them joy? Short staffing and understaffing leads to skin integrity issues. I was a wound care coordinator for 7 years. Residents who can't reposition themselves need staff to do it for them. This is true for those in wheelchairs too. Pressure injuries are devastating for the resident. For those who don't know what that is, that's a bed sore. This is so costly to the resident. The pain associated with those injuries, the time involved in treating it, this impacts the resident socially. There may be a smell, you have to schedule dressing changes, you have to offload the pressure. And for the most part, pressure injuries are preventable with enough staff. For-profit care has cost residents and their loved ones far too much. This act that we had promised them annual surprise comprehensive inspections. The government did away with this legislation with disastrous results. Who's checking that the facility meets the standards? This needs to be reinstated along with 4-hour per resident per day care and not an average. For-profit facilities failed to protect residents during the pandemic. My facility lost 50 residents, most of whom I knew. They had a face, they had a name. We were treading water before the pandemic. So many sick residents and staff. It was catastrophic. Not even enough proper PPE at the beginning. The death rates were much higher in the for-profit facilities. This is a fact. And now the policy will reward these operators with more beds. Where's the accountability? The system of for-profit has failed. We need care, not profit. Status quo is not good enough. And the pandemic, I thought, would be a tipping point. I'm not sure anymore. Thank you.
Thank you, Jean. Harrowing to hear, in such clear and immediate detail. And also on the front lines, also from a boots on the ground perspective, Bill Sinclair is here from the neighborhood group to talk about both childcare and home care and the impact of the support we do and don't invest in those services. Bill.
Hi, I'm Bill Sinclair with the Neighborhood Group Community Services, and we're a multi-service agency in Toronto providing a variety of different services, but today mostly I'm going to speak about our home care program and our childcare program. So we have 10 licensed childcare centers for over 1,000 parents every day. And we have a home care program that employs over 150 personal support workers who crisscross the city every day in people's homes, making sure they're cared for and bathed and taken care of. It's been a very challenging pandemic in these sectors, of course, but it was very challenging before the pandemic. These are systems that were on the verge of collapse in many ways, and the pandemic has really been, pushing it over. I just wanted to briefly talk about 4 of the impacts that are impacting access for people to services, and then for the challenges that have caused those impacts. So, what are the impacts? Well, quality. So, one impact is quality, that when you have not enough ECEs, when you have not enough personal support workers, when people have to rush, when people are not able to give people the quality time, similar to long-term care, you get poor quality care when there's not enough people to do the work, and when there's not enough support for people. The second is long waiting lists, and that mostly impacted childcare. We had enormous waiting lists for childcare before the pandemic, and the 86,000 new spaces will be a lifesaver for so many families if and when they can ever staff them up and create them. But the waiting lists were huge. And another form of waiting list, though, is when there's not enough home care in a community, when there's not enough personal support workers, then people have to wait. And one day in January, 580 people couldn't be discharged from hospital because there was no home care for them to go to. And that doesn't count people who were discharged just to family. So these are people who didn't have family and there was no home care that could be provided. And so that's a form of waiting list as well. The third is high fees, and I know that more affects childcare than the other, but many parents struggle with the fees, and we're the most expensive province in Canada for childcare. And then the fourth is caregiver burnout and stress. So whether you are a parent of a child in childcare, or an adult child of someone in getting home care, or an adult child of someone in long-term care, the amount of extra burnout and stress upon the caregivers is an enormous access issue in our province. So what were the 4 challenges? So people have already mentioned privatization, and removing profit from services. So when there's privatization, that means money is flowing in to provide services and flowing out the door as profit and not reinvested in care. The second is the enormous staff shortages and turnover that we've experienced. There hasn't been enough personal support workers, PSWs certified. There hasn't been enough ECEs to provide care during the pandemic. And there were shortages before the pandemic, and now it's become outrageous, like 10-20% in most organizations. The over-reliance on temp agencies, and that has become a chronic problem in home care and childcare, where because of the staff shortages, people are over-relying on temp agencies, and that's a quality issue. They don't know the children, they don't know the seniors that they're caring for. It's a new person every day, lots of challenges. And then lastly, the fourth one is the fundamental business model of how home care is provided, or childcare is provided, or frankly, services for people who are homeless and shelters and things are provided. It's very often a competitive bidding environment. It's very often a fee for service or per diem environment, where quality is not the driving factor. And these work against things like decent work, and pensions for workers and worker retention, that's not the way you should fund childcare. That's not the way you should fund home care. And that's, the billing and the competitive nature under which it's set up. So I feel that those are the challenges that are impacting those access issues of long waiting lists and poor quality and high fees and stress. Thank you.
Bill, and to look at the bigger picture, because there are some overarching issues that drive some of the challenges that we have in ensuring that we have high quality, sustainable services that people can access. Randy Robinson is here from the Canadian Centre for Policy Alternatives.
Great, and thanks for having me, Sean, and everyone. A wonderful conversation that really centers the importance of the care economy, and not just the care, but the fact that there's an economy attached to it. The thing I want to talk about today is money, and the fact that everything we've talked about has money, $50 on the wall behind Sean there. Sometimes when I do these presentations, I like to ask people, well, when do you think Ontario was the richest? And I'll get these answers. People say, well, 1945 after the war, 1967 because everything was so optimistic, or 2002, the dollar was really low. The actual answer to that question is 2019. If you take the size of the economy and divide it by the number of people, the absolute, we call it the GDP per capita number, Ontario was at its richest in 2019. So you might go, well, how come everything I want to get then is underfunded? How come, we don't have the services? How come social assistance for a single adult is $733 a month? Like, what's going on? We must be broke. Like, we must always have been broke. No, not the case at all. We were, before the pandemic started, richer than ever. And the funny thing about the pandemic, which is that a lot of people would say, wow, that must have really blown a hole in provincial finances. In fact, that's not true either. The federal government has injected $145 billion into Ontario over the course of COVID, and it's not counting the childcare deal, it's a separate thing. And $145 billion is almost, not quite, but almost the size of the entire Ontario budget. It's just a huge amount of money that has gone to people, workers, businesses. And as a consequence, public revenues are up. The amount of revenue that the government gets from sales tax is up, the amount of personal income tax is up, the amount of corporate income tax is up. So compared to the budget a year ago, the provincial budget has about $20 billion more than they thought they were going to have. So there's all kinds of money around actually right now. It's just not necessarily in the right places. Program spending in Ontario, if you think of where we are compared to other provinces, we're second worst. And being second worst and compared to all the other provinces means that we spend on average about $1,600 per person less than the average of the other provinces. So $1,600 a person, how much money is that? It's $24 billion. And I can't even talk about how much a billion is because it takes 32 years to count to a billion. If you do 1 second per, 1, 2, 3, it takes a long time to count to 32 billion, of course, takes way longer. So we are low spending. So we're $24 billion down in terms of our spending compared to the average. And the interesting thing is we're also very low compared to revenues. We collect in Ontario revenues at the rate of 15.2% of the economy as own source revenue collected by the province. The average of the other provinces is 17.5. Now you think, oh, 2.3 percentage points, that doesn't amount to much. No, it does. It's $22 billion. So that amount there between 22 and 24 billion is kind of how far off the mark we are compared to the average of the other provinces. And when it comes to program spending, the other provinces have more in some cases, and in some cases less federal funding. But in terms of revenues, this number that I'm talking about is just what the province does. And we are absolutely failing even compared to provinces with few means like Prince Edward Island or New Brunswick or Manitoba. So we're way behind. And the only reason we are not absolutely worst on program spending is that Saskatchewan is worse. And again, Saskatchewan is a rich province as well. I come from there. That's where the uranium comes from, the oil. Apparently food is still a thing. They grow a lot of wheat in Saskatchewan. Potash, Saskatchewan controls 30% of the world's potash. And yet we're not seeing money that's going into the public services. So that's got to be a major theme. I don't know if anything interesting is happening over the next 9 weeks or so, but that's got to be an interesting theme in how we approach this issue. I'm very optimistic for one reason, though, which is that I've been following labor market issues for 30 years, and I've never seen a time when people were talking about the care economy and wages in such a positive way. So I'll stop there because I've hit 5 minutes. Thanks.
Thanks very much, Randy, and thanks to the whole panel. There's a lot of information and insight and real world understanding that people now have to take into the breakout groups. We've heard a lot today about ways the province could play a bigger role and a more direct role in addressing some of these issues. And we need to think more about how we, as nonprofits, as folks who are leaders in our communities, play an active role in ensuring that the province does approach these things more effectively in ways that respond more successfully in meeting the real needs of the people that Jean and Bill talked about. There is legislation and regulations and new policies in flux right now at Queen's Park on all of these issues. We were talking just before the process started about the new childcare deal, about the new PSW funding, about all kinds of new things that are changing right now. And as the folks over at the Ontario Nonprofit Network like to say, changing ground is available ground. It's an opportunity to play a role in helping to shape what happens next. And that's what we want to spend most of our time today on, is you folks having conversations with each other about what are the priorities and what are the opportunities and what are the actions that you can take to help move our province in the right direction.